You are listening to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I'm helping women rediscover a migraine-free life. Today I'm talking to Mary, who runs our awesome Facebook community, about a common question that people ask in the Facebook group, should I get Botox for my migraines? Welcome, Mary. How are you?
I'm doing good. I'm
Good.
ready to talk about this.
Yeah. How common do you think this question is?
Several times a week, probably in one variation or another. Like either should I get Botox or I just got Botox. What do I do about the side effects? Or I just got Botox. How long does it take till it works? Like there's some version of a Botox conversation several times a week, usually.
Yeah.
And that's why I know I was teasing you before we got on, but I was like, oh, you ready to go hit some hot buttons?
I know, right?
Here's a big one.
Yeah, here's a big one.
People love when Botox works. People love their Botox.
Yeah, well, let's talk about what's going on here with Botox.
Okay.
So, Botox injections, okay? So, I think most people are familiar with Botox injections. This is used to paralyze the muscles, say in the face, so that we don't have as many wrinkles, right? And so it was used first for cosmetic treatment. Mary, you and I are old enough to remember when this first came out. It's funny when you watch old movies. Sorry, Mary, are you uncomfortable with me outing you as a fellow Gen Xer? Is that okay?
No. I thought you were going to say you and I are old enough to know that we need it. So I was like, I was like thinking you were going somewhere else with that. And I was like, yep, sure enough, Leslie, I never ever thought there would be a day that I would be tempted by the Botox gods, but I am there now.
You're getting there, huh?
Yes. I've got the 11 marks and the ones right between the eyebrows, and I'm like, hey, just sign me up. But 10 years ago, I would have been like, nah, I'm okay to grow old gracefully.
Right. Easy to say when you're in your 30s, right?
Yes. So,
right.
Anyway, so you went a completely different direction on me.
No, but I was watching, this was a couple months ago, I was watching like a movie from like the 80s before every, Hollywood actor gets Botox, and, people really look different.
It is kind of strange because, like, honestly, you look at, glamour pictures of celebrities in their 50s and 60s now, and they look as young as the 30-year-olds. And I have sat around one day and just been like, something is really strange that people are getting younger and younger. And I think it just doesn't occur to you why. How is it that people like Nicole Kidman or, Sandra Bullock or whoever look exactly the way they did 30 years ago?
Right? Absolutely. Yeah. Well, Botox and fillers.
Yeah. I mean, I love them all, don't get me wrong, but it's just kind of been a little bit of a shock to my eyeballs going, did you ever see the meme where they had the Golden Girls next to some other younger celebrities? And it was like, these people are the same age. And you're like, what?
Yep.
Like, unreal.
So yeah, we can definitely thank Botox, right, for this. It was originally used to paralyze the muscles in the face so that you can't, right, if you can't squeeze your eyebrows together, you're not going to get those little 11 marks, right, on your forehead there, right? So what happened then is that when migraine sufferers would go in and get Botox for cosmetic reasons, they reported that their migraines got a little bit better. And so, pharmaceutical industry, they're not going to miss out on an opportunity to repurpose this. Okay. And so that's what they have done. Now, I've never had Botox done for my migraines, but listening to my clients who have had it done, it is a significant number of injections. Okay.
Yeah.
If somebody goes in for cosmetic Botox, I've actually had cosmetic Botox done twice, haven't had it for several years, probably, 4 years now. was the last time
Mm.
I had it, but I've had it done cosmetically twice, and it doesn't require a lot for cosmetic application. But for migraines, it's something around 35 injections. It's
Oh my
quite a
gosh.
number of injections.
Ugh.
And they're quite painful. Okay, so they're notorious for being painful, and they're certainly painful when people get it for cosmetic reasons too. But 35 for injections, painful
No.
injections with tiny needles. There are a
Oh,
lot of people that have a fear of needles. Okay, and so this
right,
can be a real barrier for people, even considering getting Botox for their migraines, because of the number of
right.
painful injections, and then if they have a fear of needles.
Well, and I just think that whole thing goes to speak towards how we've talked about how people will do anything to get out of pain.
Yeah.
Anything,
Mhm.
right?
Yeah.
So we are not here to judge. We're just acknowledging that it is, a drastic measure to overcome a horrible situation for sure.
Exactly.
Yeah.
Exactly. So Botox, right? It's a sort of an abbreviation for botulinum toxin.
Hmm.
Okay. So that is a toxin that the Clostridium bacteria produces to create botulism, right? What we call botulism, right? So you associate people getting botulism from spoiled food, right? Like,
Ooh,
mayonnaise that was sitting out for 8 hours in the hot sun, right? This
right.
Clostridium bacteria, one of its sort of metabolic waste materials is this botulinum toxin. Okay. So when we eat that toxin, the toxic effect paralyzes paralyzes our muscles. That's the effect of that toxin on humans.
Mm-hmm.
So if people get botulism from spoiled food, they become paralyzed. Okay. And so this can be a real problem if your diaphragm becomes paralyzed and you're not going to be able to take a breath. Okay. And you would suffocate, right? So, it's there are several bacterial toxins that cause paralysis. Okay. And so this is a real problem, like the tetanus bacteria, right?
Hmm.
Produces a toxin that paralyzes muscles. So when they inject it, right, they take that little botulinum toxin, they prepare it, put it in a syringe, and inject it into your muscle. It paralyzes the muscle.
I'm over here wondering who on this is probably my question about all science in general. Like, who was sitting on the toilet one day and thought, I bet you it would be a good idea to inject toxins into people's faces. Why?
Well, again, people will do anything to get out of pain, and they'll do anything to look
Oh,
younger.
I guess. Notice though, I like that's where people get their brilliant ideas. Is probably when they're in the bathroom or the shower. But
Right?
yeah, who thought that was going to be a good plan? I just don't get it. Anyway, continue.
So when you inject it in those muscles, right, you're paralyzing those muscles, and you can't move your face and make those lines on your face, right?
Mm-hmm.
So with migraines, they're doing a lot of injections in the head and in the neck. Okay. And so
Hmm.
that's causing a paralysis in the muscles in the head and the neck. And it's a subtle effect. Okay. It's not like people can't move their face at all. It's a subtle effect, but it prevents the muscles from contracting as much as they normally would.
Hmm.
So why does this help migraines? Okay.
Hmm.
So they actually don't know exactly why this helps people's migraines.
Hmm.
And this is true actually for most pharmaceuticals. They actually do not know why they have the effect that they have on the body.
Hmm.
So, one of the most shocking moments of my life was in naturopathic medical school. So, the first 2 years of the curriculum, you learn everything about how the body works. And so, the curriculum is what they call in medicine the basic sciences. So, embryology, how is the embryo formed? Physiology, biochemistry, anatomy, microbiology, histology, all of these topics that are called the basic sciences in medicine. So
Hmm.
the first 2 years of the curriculum, we learned how. how everything works. And then we learn pathology, kind of how everything breaks down. And so the third year is when we started pharmacology, started studying all of the medications. So again, in the naturopathic medical curriculum, we have to learn all of the same medical sciences, all of the same pharmacology. We have to learn all of this, all of the conventional lab work and imaging, radiology, all these things. We have to learn all of those same topics. So I remember going into my third year, my first of 3 pharmacology courses. I was so excited. I was like, all right, I learned, how everything works and how everything breaks down. Now I'm going to learn how all these drugs work
Mm.
because I knew the biochemistry and all this stuff, and I was going to learn how the drugs, did what they did. And in the pharmacology textbook, I have it here on my shelf, the standard pharmacology textbook. Like in the introduction, they stated, we really don't know how most of these things work. What they do is they observe the effect on the symptoms that the drug has, but they really don't know for most medicines. They do not actually understand how they are manipulating the biochemistry at the at the molecular or the cellular level. Okay.
Mm. Oh, that's
So
interesting.
Botox is no exception to that, right? And I'm telling you, Mary, I could not believe this when
Mhm.
this hit me because I assumed that the drugs that people were taking,
Mhm.
I assumed that they knew what they were doing in the body.
Mhm.
That was a false assumption.
Right.
Okay.
I mean, I think
So,
most of us assume that scientists know on that level what they're doing. Not
correct.
just
Correct.
scientists, but like that they understand things on a biochemistry level and all of that. Yeah.
Correct. Correct. So
Mm.
Botox is one of these treatments where they observe an effect, but they don't know exactly why the effect is being generated. Okay.
Hmm.
So there's 2 likely reasons, and it might be a factor of, might be a combination of both of these reasons. But first reason is most migraine sufferers have muscle tension in the
Mm.
neck, in the head, and the shoulders. They can feel that.
Mhm.
And many chronic migraine sufferers will report, if I'm kind of at my desk at the computer for too long, and if I have poor posture and I'm holding my neck in a certain way or holding my head in a certain way, that can give me a migraine. That can lead to a migraine.
Mhm.
So if you paralyze those muscles and therefore have less tension,
Hmm.
is that going to have a positive effect for some people? Okay.
Mhm.
It's a reasonable hypothesis.
Right.
Okay. So that might be one reason why Botox is helpful for people. So if people are evaluating whether or not they want to do Botox, I think a critical question would be how much muscle tension do I experience in my head and neck?
Mhm.
Okay. If the answer is little to none, I would really question whether or not you would want to consider this.
Mhm.
Okay. So that might be one reason why it helps migraine sufferers. The second hypothesized reason is that the botulinum toxin prevents in some way the pain signals through the nerves. Okay, this
Mm.
is sort of the standard hypothesis as to why it might work. This
Mm.
I'm less enamored by this hypothesis,
Hmm.
okay? Because you have a real risk with Botox. And it's a
Mhm.
risk that is in the fine print whenever you go in for cosmetic Botox. It's in the fine print when you go in for Botox for migraines, but it's something that's not really discussed very much at all. But there's a risk when they put that needle in, they can inject that botulinum toxin into your nerve by mistake.
Mm.
And when that happens, that toxin can travel up the nerve and it could go into the spinal cord, could
Oh.
potentially go into the brain. And so there is a very rare side effect of Botox usage where people have symptoms that are neurodegenerative symptoms
Hmm.
because the the botulinum toxin is harming the nerves, and as it moves up to through the spinal cord and into the brain, the nervous system itself.
Mhm.
So, if you had an effect on actually blocking nerve transmission, I don't know. We're getting into kind of dangerous territory here.
Yeah.
So, this is, like I say, this is if you go on, WebMD, Mayo Clinic, they're going to talk about this hypothesis as to why Botox works. But I think it probably has more to do with the fact that you're paralyzing the muscles in the head and the neck, and you can't generate as much muscle tension, which for some people can exacerbate their migraines. Okay.
Mhm.
But so we really don't know why this helps people. Okay.
Right.
So, some people, they do notice an effect with Botox. Okay. I've had other clients where they did it and it really had no noticeable effect. Okay.
Mhm.
Again, I'm not an expert on Botox. I help people discontinue their Botox. But to me, if somebody were considering Botox, I would be much more, not that I recommend Botox, but I would be much more, I would feel more confident that they would get relief if they are someone who has a lot of head and neck tension
Mhm.
as part of their migraines. And if somebody doesn't, then I would really, I would really doubt that they would get any uh, improvement from it. Okay.
Okay.
To qualify for Botox, you have to have a chronic migraine diagnosis, which is 15 or more migraine days per month. So you really have to be in that true chronic migraine state.
Mhm.
And then, usually, for insurance purposes, your insurance is not going to cover it unless you have failed other, much less expensive treatments.
Mhm.
So this is failing, triptan medication, failing things like Topamax, pretty strong meds have to either fail you or become ineffective before insurance companies are going to consider paying for Botox.
Mhm.
Out of pocket, this is going to run you in the thousands of dollars, and it's done quarterly.
Right.
So, a typical, cost of Botox once a quarter is $3,000 to $4,000.
Mm.
So it's a lot. It's a lot. I mean, that's quite a bit in a year. And then you got to go in every 3 months and got to get all these injections. So usually people are not going to even consider this unless their insurance is going to pay for it.
Mm.
And like I say, most insurance companies, they're not going to approve this unless you fail cheaper therapies.
Mhm.
And sometimes people have insurance coverage where they just pay a copay every quarter and insurance picks up the rest of the $4,000. And I've had other clients where, they have a $9,000 deductible. And so they're going to pay out of pocket for the first, two and a half Botox treatments
Oh
per
my
year.
god. I mean, I'm just gonna say I would rather spend my money on something else, but
Yeah, for
I mean,
sure.
again, we're not here to judge what people are, willing to do for getting out of pain. We get it.
Yeah. Now, what are the downsides to Botox? Okay. So,
Mhm.
first of all, we are injecting a toxin into our muscles. So, if you have been following the podcast, if you've listened to any of the free training that I have, injecting a toxin into the body is going to be counter to restoring our health.
Mhm.
Because one of the principles of restoring our health is what I call the second principle. This is clearing metabolic waste material and toxins from the body. So, if
Mhm.
we are injecting botulinum toxin into our muscles, the body is going to have to work hard to get that out.
Mhm.
And it takes about 3 months for the body to clear this. And this is when it starts wearing off.
Hmm.
And then you got to go back in, and then you're going to do it all over again. So when you have chronic migraines, if you're having 15 or more migraine days a month, you already have an overload of metabolic waste material.
Mhm.
Now we're going to inject more in.
So this is probably a dumb question, but like we're saying it is bad for our bodies to keep adding toxins, but at the same time, Botox is limiting how many migraines you're getting. So it's like one thing we're saying is it's bad for you, but it's showing that it's quote unquote good for you. Like, how do you explain that contradiction? Does that make sense?
Yeah, well, what Botox is doing
Mhm.
is suppressing the
Mhm.
migraines, right? When the body clears that toxin and we experience that as wearing off, oh yeah, next week I got my Botox appointment is what's wearing off, right?
Mhm.
Right? We don't have a Botox deficiency, right? We don't have migraines because we have a Botox deficiency. So the Botox is suppressing the body's ability to generate the migraine. It is not correcting the underlying issues that are generating the
Mhm.
migraine. Yeah. So there's a difference between my migraines are better from the standpoint of I'm having less per month.
Mhm. I'm suffering less,
I'm suffering less
but
and
it's
my
healthy.
body is generating less migraines,
Mhm.
right? If we don't get the Botox, the if we don't get that Botox after the toxin gets cleared from the muscles, then I'm right back where I started, or
Mhm.
even worse.
Or worse. When I know I see in the group quite often, not just Botox, but with several different meds, all of the sudden your insurance changes and then you're back to square one because you can no longer get your treatment
Hmm.
and you haven't done anything to actually address why you're getting migraines in the first place.
Right, right. And unfortunately, you further undermined your state of health because you've been injecting all these toxins into the body.
Mhm.
Right. So it's an important distinction, right? Because again, when somebody is at the point where they're having 15 or more migraine days a month, like you
Mhm.
say, they're going to do anything to get out of pain,
Mhm.
right?
I mean,
The
I don't
problem
blame
is in that state of desperation,
you.
right? When people are desperate, whether it's migraines or some other desperate situation that they're in their life, right? When we are desperate, we can make decisions that in the long term are not going to be beneficial for us.
Right.
uh that's an issue with Botox as a treatment. The other issue that again is not discussed, so if I'm paralyzing the muscles of my neck,
Mhm.
what's going to happen to those muscles over the long term? The
Right.
muscles in my neck need to contract and they need to be strong enough to hold my head up.
Mhm.
If I'm paralyzing them and preventing them from contracting, which again, muscles get stronger by contracting,
Mhm.
by moving, right? Somebody has somebody's in a coma for 6 months and they're just laying in a hospital bed. They can't just get up and walk, right? Their muscles have atrophied.
Mhm.
So when we inject Botox into the neck, we are paralyzing the neck muscles. We are preventing them from their full range of movement or contraction. And over time, they will atrophy.
Mhm.
People who use Botox for several years are eventually told we can't do this anymore because your neck muscles are going to atrophy if we keep doing this.
Oh my gosh.
This is not told to people when they start out. But think about it. Our neck has to be strong enough to hold our head up.
Mhm.
So this is a bad idea
Yeah.
in the long term. It is not a long-term solution.
I actually know a gentleman that had cancer in his neck and his muscles were no longer able to hold his neck up. And I mean, he is the most incredible, gentle, kind soul. And so I don't want to make that sound bad, but like, that's just not a life you want. That's a
Mm-mm.
struggle that, people don't want to have in the
Yeah,
long run.
yeah.
Yeah. Ugh.
And how many women in their 30s are getting Botox for their migraines?
Right.
You got a long life ahead of you.
Do we really like have, I mean, Botox is still relatively new. Do we really have long-term, 50, 60, 70-year studies on what happens in the long run to our bodies?
We sure don't. We sure don't.
Mm,
And I think the amount of Botox that is given as a migraine treatment is significantly higher than what is given to typical, cosmetic application, right?
mhm,
The 2 times I've gone in for a little Botox, it was, tink tink. I mean, it was just a couple little pricks of the needle. It was not, 35,
right.
right? And frankly, unfortunately, there's a member of my community, very tragically, uh, used cosmetic Botox and is now suffering from this neurodegenerative disorder that I described that is in the very, very fine print of the
Mhm,
consent paperwork that you sign when you get Botox.
hmm,
So, well, and the symptoms are sort of like a ALS or Lou Gehrig's disease with this progressive neurodegeneration, progressive muscle wasting, progressive. I mean, brain to call it brain fog doesn't even do it justice. Okay,
mhm,
it's a very very debilitating and tragic condition, and so you know when this like I say, when this tragic case became known to me, I have not scheduled any other cosmetic Botox appointments.
I know, I feel like you've really cured me of any temptation I've ever had for it, like
Yeah. So again, it's a low risk, but again, here's something, right, where okay, yeah, I got a little line too between my eyebrows now. Do I really want to have a neuro, do I really want to risk getting a neurodegenerative disease from this, or maybe I just put a little stronger, little stronger night cream there.
I was gonna say, I'm not sure night cream might be past that point, but whatever, yeah. I'm just gonna have to grow old gracefully, quote unquote gracefully.
So,
Yeah.
somebody getting this, like I say, for migraines and all of the injections that are required every 3 months, unfortunately, you're going to be at a much higher risk of, by mistake, them injecting that botulinum toxin into the nerve of the muscle. Right? They're not trying to do that. They're trying to be very careful because they know they don't want to get this in the nerve. They know they want to get it in the muscle. But y- you know, there's no way of knowing whether you've got it in the nerve or the muscle.
Right. Right. Oh, scary.
So that I think that kind of covers what my concerns are around Botox.
Mhm.
I've worked with many clients over the years that when we start working together, they are taking Botox. They're getting Botox treatments, and I have to say that this is one of the easiest treatments for people to discontinue.
Oh,
Um, it is done every 3 months. The body is naturally clearing this botulinum toxin out of the muscles. The body is going to get on that immediately and start clearing that out, getting it out of the body over time. And so, what I see over and over again is that when people start feeling better, they say, "Well, yeah, you know what? I got this Botox appointment coming up in 2 weeks, but by now, 2 weeks before my appointment, I would be feeling my headaches and migraines by this point, but I'm
mhm,
feeling fine. I'm not feeling it, right? Again, when we restore our health and our body is not generating the migraines and the headaches, then instead of, oh no, I'm going to be in agony a week or two before my 3 month Botox appointment, we feel good. We feel fine. We don't feel any,
mhm.
we're smooth sailing.
Right.
So that's an indication, okay, yeah, if I don't go get it now, I'm probably going to be just fine. And that's what
Mhm.
usually happens.
Well, kind of
So,
cool that you have that time between appointments to work on getting the body in a state of health so that when that 2-week period is coming, people see that difference.
mhm, mhm.
Right?
And
That's cool.
that's what we're looking for, right? Because again, when we're restoring the health, we are going to experience improvements in our symptoms,
Mhm.
right? And so it's much easier to discontinue a preventative medication or treatment like Botox when we're feeling better.
Right.
Right? Many people have said, you know what, I really hate going in for these 35 injections. You know what, I got the appointment next week. Let me just see if I can make it through. Let me see what happens. Well, they didn't do anything to restore their health, and so their migraines get bad again.
Right.
Right? The difference is when you restore your health and you're feeling better, then it's obvious that, oh, yeah, okay, I got my appointment coming up. I'm really considering maybe I don't want to do this
Yeah.
anymore, right? And we
Yeah,
have
a
that
little bit.
confidence going
Yeah.
in because we're actually feeling better.
I was gonna say a little bit of, hope there that maybe
Exactly.
we don't need it. Yeah. Well,
Exactly.
let me ask you, just because this pops up so frequently in the group, what are the different other than, the risk of paralysis, but, like, other than that, what are the common side effects people have from Botox?
Well, many of my clients will talk about how they get a headache or they will get a migraine after the treatment.
Mm, mhm,
I've seen that a lot. And that could be due to several factors, I think. One, for most people, they're going to feel pretty mentally and emotionally stressed out going in
mhm,
and getting 35 painful injections.
mhm,
And so, again, a lot of people, if they are under mental or emotional stress, highly likely they're going to get a migraine.
mhm,
Okay. So that can be a factor for people. The other thing is you are injecting a toxin into your body.
right,
This is counter to what is health supporting. And so
mhm,
when you have a big influx of toxins into the body, whether it be botulinum toxin, whether it be, say, alcohol is a toxin, right? You have a big influx of toxins into the body. And you're prone to migraines. It's a great way to get a migraine.
yeah,
So I think those are the two most likely reasons why this post Botox headache or migraine occurs.
mm, mhm,
But I hear that reported pretty commonly that
mhm.
for a day or two after the Botox treatment, they're not going to feel too good.
Right. I've seen a lot of comments about how, numbness, like complete numbness on one side of their face or, those kind
Well,
of things
yeah,
too.
this can happen with cosmetic Botox, right? People go in for cosmetic Botox, and again, if too much is put in the muscle and the muscle is over paralyzed, right? People can have their eyelid droop or,
Yeah, drooping.
things like that, right? So, the skill, right? Again, you get cosmetic Botox, you don't want to go to the fly by night med spa. You want to go to the top top people, right?
Right,
Because
right.
the skill of the practitioner there with the needle, right? Their skill is going to play a tremendous role.
If they're in a dark alley and they have all hours of the night, beware. No. Like, be careful out there, ladies.
Exactly.
As far as comparing apples and oranges go, I see a lot of questions from people like, how long till my Botox will, kick in, meaning how long till I stop getting migraines, um, versus how long it takes to work with you and restore your health. What's the difference there? Like, does it take 10 appointments before I stop getting migraines with Botox versus 10 appointments with Leslie? Like, what's the contrast there? Does that make
Yeah.
sense?
Yeah, yeah. So, um, Botox for migraines. I can't think of a client. Well, and there's going to be some bias in this because the people who reach out to me are the people who, the treatments and the medications aren't working. You know,
Mhm,
that's a typical client that I have. Not that you have to wait that long to work with me, but usually those are the people that reach out to me. So with my client base, I would have to say that with the clients that I work with, the Botox is no miracle treatment. It might
mhm,
take them down from 20 migraines a month to 10.
mhm,
Okay. So Okay, well, that cut him in half. Okay, well, great. Well, I'm still, 10 days a month, a third of my life, I'm still having a migraine. Okay.
Mhm.
So it's not that people aren't happy that they went down from 20 to 10, but I mean, 10 is not great.
Right.
10 is
It's
pretty
still
bad.
still significantly hampering their ability to do life at that
Exactly.
point. Mhm.
So I wouldn't say that in my experience that it's some sort of miracle treatment. But again, the people that are going in for Botox and they never have another migraine, for a year after they get that every quarter, they're probably not going to reach out to me unless this really connects with them that, look, I don't want to be taking this Botox. I don't want to be injecting this toxin into my muscles. I want to get to the root cause. But most people, if the drugs are working, they're not going to reach out to me. So it's a little skewed, from that
Gotcha.
perspective. But I wouldn't say that it's any panacea. I mean, even looking here on webmd.com, does Botox work for migraine headaches? So, in two studies, the headache days were cut in half, right? So,
Mhm.
and that was, half of the people in the study who did 2 rounds, so that would be 6 months, reported that their migraine days cut in half. So half of the people had half of a reduction,
Got it.
right? So, it's not it's no panacea for sure.
Mhm. Mhm.
It takes the edge off a little bit, I would say.
Yeah.
And I think the risks associated with that, as we've talked about, uh, you can say it's a low risk, but statistics mean nothing when it happens to you. This is the problem.
For sure.
Yeah. But like I say, the thing that I find, this is something that's very easy for people to discontinue. Once they start feeling better and that appointment comes up on the calendar, very frequently people will be reluctant to out and out cancel that Botox appointment, but they'll say, you know what, I'm going to call my neurologist and I'm going to move it out a month.
There you go. Yeah.
Right. And I think that's a great strategy. Whenever
Mhm.
somebody is coming off of a preventative treatment, whether it be
Mm.
Botox, Topamax, birth control, any of these myriad preventative treatments, you have to have a level of confidence
Mhm.
to come off of those preventative medications.
Right.
Otherwise, people have tremendous anxiety. Well,
Right.
I'm still suffering with the Topamax, but I hate to go off of it. What if it's doing some small thing that I'm not realizing and then I'm worse,
Mm.
right? By the time people are in a chronic migraine state on preventative treatments like Botox, they're terrified of doing something that's going to
It
put them
just
backwards.
oh,
Yeah.
yeah. One, honestly, I don't blame him.
No, I
That's
don't blame them at all.
if yeah, and the whole anxiety thing, we've talked about that in the group lots, that of course you have anxiety and some depression because this is not how a normal life is supposed to look, right?
Mhm. Mhm. Right.
Right.
Right. It's normal to have anxiety if you can wake up in the morning and feel fine and by 4 p.m. struck down, vomiting on the side of a road, trying to get home
Mhm.
from work. That's my story, right? Of course you're going to
Mhm.
have anxiety if that's something that could happen to you. You're going to have a post-traumatic response to that. That's very common with migraines. So when people are, when I'm working with people who are using Botox, they'll say, "Well, I just got Botox, 2 months ago. In a month, I have my next appointment for it. Should I cancel that?" I never tell people to cancel things like that. Sometimes people are feeling well enough in a month where they feel like, "Yeah, you know what? I'm gonna cancel that Botox, or I'm gonna push it out another month." Sometimes people are not feeling well enough after a month of working with me, and they say, "Yeah, you know what? I'm afraid not to get the Botox because I'm
Mm.
feeling a little bit better, but I don't want to get worse without this Botox." Fine, get the Botox. It
Mhm.
doesn't interfere with what I'm working on with people.
Mm.
We're already, if I'm working with people, we're already working on clearing toxins from the body. Yes, you're going to inject more, but that's okay.
Mm.
You will still get better. And then
Right.
when people are ready, uh, they can cancel that appointment or push it back. A lot of times people will say, it took me so much to get that improved by my insurance. I don't want to
Mm.
cancel it outright, but let me just move it back a month. Let me move it back a month. I've had many clients, they'll just keep keep rescheduling it and pushing it back out until they finally feel confident. Yeah, you know what? I'm steady now. I really don't need this. And then they'll kind of take that final step and finally cancel it.
You kind of highlighted something that I think is important to just touch on is like, I think sometimes when I go into the doctor, I'm hesitant to take the first steps of meeting with someone new because you're almost afraid that they're going to demand you do their things their way. And
Mhm.
they're, if I want to still get Botox, they're going to be like, well, then I can't treat you or whatever. And to me, it sounds like just based on our conversations that you do take those things into consideration and the person still has a lot of say in what your treatment looks like and that kind of thing
Yeah.
is.
Yeah, this is a real cornerstone of how I work because most of my clients are taking medication. Many of them are taking quite a bit of preventative medication,
Mhm,
propranolol, Topamax, birth control, and Botox, a lot of preventative medication. And so there are a lot of practitioners that say, come back when you're off of all of your meds.
mhm.
So, how do you get off of the meds without restoring your health first?
Without the support. Yeah.
Exactly, exactly. So, this was really important to me when it's been actually 5 years now that I completely changed my practice, dedicated my practice entirely to working with women with migraine headaches. It was really important to me to be able to figure out a way to help people who are on serious medication.
Mhm,
Because when you are on Topamax and birth control and Botox as preventatives,
mhm.
you're going to go through excruciating agony if you are going to go off those medications first and then work on restoring your health. You,
Right,
I wouldn't be able to do that. It's
right.
not a matter of willpower, toughing it out. It's not going to be possible for people.
Mhm,
That is a
mhm.
bar that I can't even imagine somebody being able to go over.
Right.
But a lot of practitioners say this. You got to
Mhm,
get off all meds and then I can help you. Well, okay. In order to get off these meds, I got to feel better.
right. Well, and most of our people have to work and they have children and they have families and they have like you can't just lay in your bed for 6 months while you get off meds and then go and get help. Like
Right, right.
it
And,
doesn't make
many of
sense.
my clients are already laying in bed on 4 preventatives and taking Nurtec and Imitrex
Mhm.
a couple times a week. They're already in bed,
Right.
right? So you can't just, cold turkey somebody off of these meds. It's too much.
Mhm.
It's inhumane. It's
Yeah,
inhumane.
that's a very
So
good.
this was a real top priority for me. Under first of all, prior to me making this big change in my practice and so on, prior to this, I was working with people who were on serious medications. I was working in an inpatient naturopathic clinic and working with patients who were on serious medications.
Mhm.
Things like Seroquel and gabapentin and Topamax and things like that. So I already had significant experience working with people on heavy meds.
Mhm.
And a lot of natural practitioners, they just don't have that type of experience, I'll be honest, because
Mhm.
most natural practitioners are working with people who are coming to them because they don't want to get on the medications in the first place. And so they're kind of going to the chiropractor before they get on the meds. They're going to the acupuncturist before they get on the meds. They're going to the naturopathic doctor before they're on the meds.
Mhm.
That's not my typical client. I will have
Right.
those cases for sure, and I'm happy to help those people. But my typical client is already on heavy duty medication.
Mhm.
And my experience with that medication previously, I know you're not going to be able to come off of those unless you are restoring your health and you're starting to feel better. You're not going to be able to do it.
Right.
It'd be inhumane to think
Right.
otherwise. So this was kind of my going in 5 years ago. And a lot of people thought I was crazy. They did not think it could be done. I was told by many colleagues, yeah, you're not, if somebody comes to you on Topamax, you're not going to be able to help them. They got to come off that first. It's not true.
Mm,
It's not
that's
true.
interesting. Don't you love proving people wrong? I love that. But I mean, just really quick, I just want to like reiterate just how much autonomy and respect and how much consideration you're giving for the people that you're working with as well. Because I think a lot of times doctors, we just go in and it's like doctoring happens to us. Do you know what
Mhm.
I mean?
Mhm.
Like, here, let me throw you some meds, and it's not about what I feel as a human. It's just, here's what I can do for you. Now go on your way. But,
Right.
you're working with people in a way that's like they're your partner in this whole thing.
Well, they're the one doing the healing.
Hmm.
Right? I'm not healing anybody.
Yeah. You're just
It's
kind of
our body that does the
right.
healing for us,
Yeah.
right? And nobody heals me but me. I don't
Mm-hmm.
heal anybody else and nobody else heals me. That's not how this works. We
Mm-hmm.
are the healer. And so we can't be doing something that is counter to what is possible for us, that resonates with us, that's doable, right? Mary, you've got 4 boys, right? If I'm working with a woman who has 4 boys, it's going to be what is going to be possible for her, doable for her,
Mm.
resonate with her is going to be different than I'm working with a 65-year-old woman. Her and her husband are retired. It's the two of them, empty nest. It's a totally different ball game, totally different
It
environment.
really, really is.
Yeah,
Different
absolutely.
struggles. I mean, in reality, like they're both hard situations in their own way, right?
Right, right. You know, um, People have different religious or spiritual beliefs or practices that they're coming from. I wouldn't, we're not going to heal ourselves if we are going to go against a core value that we have.
Mm.
That's
It's
going to be
so true.
counterproductive.
Like, we're not here to tell you you no longer can be Christian. Now you have to be a Buddhist because that's not going to help them in the long run,
Right,
or vice
right.
versa. Hmm.
Right. Yeah, that's some people really resonate with doing meditation. For
Hmm.
some people, that goes against their religious practices.
That
Oh,
just goes against my attention span.
okay, goes against yeah, exactly. For some people, right? They're having symptoms around attention, and meditation is going to be something that's going to set them up for failure. Absolutely,
Right.
right?
Yeah,
So
exactly.
these are absolutely the things that I'm taking into account with all of my clients. What is going to set this woman up for success?
Hmm.
And that's going to be different for everybody, depending on all of these different situations that they're in, depending on the severity of their symptoms and the whole bit.
Hmm.
These 3 principles that I talk about that are required to restore our health, those are universal principles that apply to everybody. But how we implement those 3 principles, it's a totally unique journey and path for people.
Hmm. I love that.
And what I like to do for myself or what I find easy can be unbelievably difficult for some people.
Yeah.
And I have clients, they do things on their healing journey and I say to myself, "Man, I would never be able to do that."
Right.
Right?
Well, you just talking about the women who was that last podcast that we talked about how some women tough it out and run marathons. I'm like, I can't even do that on my best health days. Like,
Exactly.
these women
Right.
are gladiators or something. Because,
Right. Right. Some people really like to exercise. Other people
hmm,
really, it's really not their thing. So I'm not going to tell somebody that doesn't really enjoy exercise, "Oh yeah, we need to get you exercising blah blah blah." Right?
hmm,
There's other ways to get the benefits of the movement that exercise brings, other than having people do an activity that they don't enjoy.
it took me 40 something years to realize that I'm a much happier exerciser if I'm not running, but I am dancing.
Yeah.
So why,
Mhm.
why does that matter? I don't have to be a marathoner to get exercise. I can be, some women really love to walk. That to me feels like the most unproductive
Uh-huh.
use of my time. Like I am
Right.
going nowhere and doing nothing. So, I mean, it doesn't have to be a one size fits all um, type of thing, right?
Exactly.
Yeah.
Yeah. Most practitioners, they tell their patients or clients to do what works for them.
Mm,
This is a really, really big problem in the natural medicine space
mhm,
because most practitioners in the natural medicine space, they've gotten into the natural medicine world because of their own healing journey or experience.
mhm,
And so they know what works for them. And then
mhm,
they tell everybody else to do that same thing. Well, it's a real big problem. It's a real big problem. So you have somebody, like say somebody starts eating a vegan diet and they feel better. And then they go out and everybody they work with, they tell to eat a vegan diet. Okay.
mhm,
So for myself, we humans, we're going to have a tendency to do this. Okay. The human psychology, this is, it's going to kind of pull us to do this. Well, it worked
mhm.
for me. Let's have you do it. Okay.
Right,
This is why
exactly.
people give us advice, right?
Of course.
So, but for myself, I'm always on guard with this psychology within myself. And I
Mm,
test everything on myself. So
mhm,
I'm constantly testing things. Whenever there's a new fad diet, I give it a go. I test new combinations of herbal medicines or whatever it is. I test out so much stuff on myself so
mhm,
that I can experience the differences between these different things. I can get some glimmer into what some of the risks are. Um, but then I'm always, too, you know, testing things out on clients. I just don't do the same thing every time. I'm always
mhm,
integrating new things. I'm always, you know, got these little research projects that I'm on, different little things that I'm doing, and then integrating that. Might test something on myself, and then I might have one client that I think might respond well, have that, give it a go. No, let's try a second one. Like I'm always testing things and
mm.
collecting that data, observing what happens and collecting that data. And again, because I'm not just, oh well, this is, I go to bed at 10 p.m. So let's have everybody go to bed at 10 p.m. because that's when I feel the best myself. Because I don't do that, I have so much experience of, okay, what happens if somebody goes to bed at 11, midnight, if they go to bed too early, right? Because I'm not dictating everything to everybody else. I'm collecting what the body is telling us and making adjustments and so on. I have a much larger data set that I've accumulated over the years because I'm not
Mm.
just handing people a handout. Okay, go do this,
Yes,
right?
exactly.
Just the other day,
Mm,
I was working with a woman where, she was kind of at a crossroads where she could either start to, her sleep has improved quite a bit. And so we were at a little crossroads. Does she want to go to bed a little bit earlier? Or does she want to sleep in a little bit later and go to bed a little later? Right? Her sleep quality had improved to the point where she was sleeping, good 8 hours through the night. And now we could tweak the timing a little bit.
mhm.
And I had her make that decision. Do you want to go to bed a little earlier? And her husband goes to bed a little bit earlier. So there was kind of a decision. Do you want to go to bed with your husband and wake up a little bit earlier, more along the time when he wakes up? Or do you want to um, stay up a little later and sleep in a little bit later in the morning? But then you wouldn't be going to sleep at the same time your husband is.
Mhm.
Either way, I felt would be health supporting for her.
Mm,
So it was up to her what she wanted to do.
that's awesome. I mean, simple, but I just love that it goes to how individualized you really are as far as a practitioner.
Right. Other people were getting signals from the body. Yeah, you know what? You going to bed a little bit later and waking up later, I don't think that's going to be health supporting for you. So I'm
Mm,
really going to recommend we carefully move the sleep schedule a little bit here to be more health supporting for you. Right. So again, I don't have this like, okay, everybody goes to bed at 10 and wakes up at 6. Okay, what is going to be health supporting for this particular person?
Mhm.
I have clients that work third shift, second or third shift. Well, they can't go to bed at 10. They're working,
Right.
right? They've got to sleep later than 6. They were up until, 2 in the morning. They can't get up
Right.
at 6. They're going to have to sleep longer. So there are, some realities of people's work schedule or other things that have to be taken into consideration.
Yeah. That's I think that's how all medicine or, treatment should be. Like, I don't know, I think eventually society is going to burn out on one size fits all medicine. I really do.
Mhm. Mhm. Well, what I think people are also really burning out on is using these drugs to suppress their symptoms.
Mhm.
People are really waking up to the fact that they don't have a Topamax deficiency.
Mm.
They don't have a botulinum deficiency. They don't have an Imitrex deficiency.
Right. Well, and I think there's been, especially since COVID, and I don't want to get into super controversial things right now, but like, especially since that and the whole vaccination controversy and all of that, I think people are waking up to the fact that pharmaceutical companies don't necessarily have my best interest at heart as an individual.
Correct. If you look at the damage settlements, the prosecutions for fraud and the damages awarded to people, you're
Mm,
not going to find another industry that
mm,
has more judgments against them, more damages levied against them,
mm,
more, unfortunately, there's a difference between a pharmaceutical company putting a drug on the market that has unintended severe consequences for the people that take that drug.
right.
But over and over again, unfortunately, what the pharmaceutical industry has been proven to have done is they have known that the drug is causing a severe consequence in the people that are taking them, and they
Mm,
bury that. This
and
has happened
ignore.
over and over again. Yeah, they
Mm-hmm.
they they know that it's happening, and they take conscious steps to bury that data.
Mm, which is
And this is
really,
when this is when they get hit with these, multi-billion dollar judgments against them.
mm-hmm.
Because again, there's a difference between something that's an oopsie, oh my goodness, we didn't think about that. And then there's something, I frankly I think it's evil to
Mm-hmm.
have an industry that over and over and over again has cooked the books, basically.
Mm-hmm. Yep. Agreed. Very much agreed.
In naturopathic medicine, we take it in oath. I have it right here, in my office. And the first piece of the oath of the naturopathic medicine oath that we take when we are awarded our diploma is
Mm-hmm.
first do no harm.
Right. And doctors take that whole oath too, right? Right.
Pardon?
Like medical doctors take that oath as well, from what I understand, right?
They do, but it's a different meaning for them
Mm, right.
because the harm is inherent in the medication.
Right. Well, my question was going to be following up with that. Like, they take the oath. Obviously, you have a different weight or meaning around it. You take the oath, but do our pharmaceutical companies?
No, the pharmaceutical companies do not take any oath.
Exactly. And that there we are with the problem, right? I mean, not just that an oath is the solving of all of it, but they don't have a, how is this going to affect Mary 20 years down the road oath? Like,
No,
they're not
no,
concerned with that,
right.
right?
And the medical doctor taking that oath, the mindset is more, don't make a mistake.
Mm. Mhm.
Don't improperly prescribe the medication that's going to
Mhm.
cause harm by definition.
Mm.
Every medication has side effects. Every medication causes harm, right? So in conventional medicine, when they take the oath to, first do no harm, it's,
Mhm.
don't malpractice.
Right.
Don't be careless, right?
Right.
For in
Try not to
naturopathic
kill
medicine, what
people.
we mean is don't
Yeah.
harm people.
Mm-hmm.
right? And
Quite
so I
literally.
don't do things that are going to harm people.
Mm-hmm.
And in the natural medicine world, there are plenty of therapies that can harm people. Don't get me
Right.
wrong. And unfortunately, there are some naturopathic doctors that do those things, and they kind of, they don't live up to the oath that they've taken. But I
Mm-hmm.
take it very seriously.
Right.
And
And
first
I
do no
kind of,
harm can also apply to the way that people are just treated mentally and emotionally.
right.
Right? Some people are harmed by their doctor because the doctor is, careless with their words or rude, abrupt, blaming the patient, right? That can cause mental and emotional harm to people. So
Yeah.
I'm not perfect. I'm not saying that I'm perfect or anything like that, but I'm very conscious of these things. We
Yeah.
can cause harm with the therapeutics. We can cause harm with how we approach people, how we interact with
Mm-hmm.
people.
Being dismissive, telling people it's in their head,
Mhm.
telling people to lose weight, there's nothing wrong with them. I
Mhm.
mean, the list can go on and on for
Yeah.
sure.
People can be mentally and emotionally abusive to other people. This happens all the time,
Absolutely. Yeah.
right?
I was gonna say too though, but going back to do no harm, it's like since we're talking about Botox, like we don't know what the long-term effects of, 50 years on Botox is gonna do.
Right. Yeah.
I think
But
that's
their oath doesn't include that. Their oath is like, don't jab the Botox needle in the aorta, right? It's like, in the carotid artery, right? It's like
please, please
that
don't
type
do
of harm, right? They're talking about that type of harm, right?
Yeah. Yeah.
Because they can't, a medical doctor can't practice without harming the patient,
Mm,
because the treatment is a drug and drugs inherently harm us.
mm. That is something to think about a lot. I don't know. Because I think our mentality around drugs is that it's there to help us, not that they inherently harm us.
Right.
That's
Well,
a mindset shift we've all got to make.
when and where is the harm occurring, right? If I take something that suppresses my migraine and I feel better 20 minutes later, quote
Mhm.
unquote, I feel better, right? 20 minutes later. But what if the harm comes up 10 years down the road?
Right.
Right? What if, again, like look at the typical progression when somebody starts on, say, Imitrex. Okay?
Mhm.
Typical migraine sufferer, they can't use the over the counter stuff anymore, and so they finally make that appointment with their primary care doctor, or, God forbid, a neurologist, and they go in there and they get the Imitrex for the first time. The first time they take the Imitrex, for most people, it quote unquote works within 20 minutes.
Mhm.
Now, 5 years later, right? They're taking Imitrex a couple times a week. Their doctor's yelling at them, you can't take so many. Now they're on Topamax, gabapentin, and birth control. And now they can't have
Mm.
a baby because they're functionally infertile because they're on birth control for their migraines.
I would say that falls under harm.
Yeah. But the first 15 minutes, 5 years prior, boy, did that feel good.
Right. Hmm. Yeah, I just think that's a lot to chew on.
Yeah. Yeah.
I might need a few days now.
Let that process, right?
Yeah, I need to recover from podcasting today. No, I'm just kidding.
Right? Well, when we started on this topic, you were like, "Oh, you're gonna push a lot of buttons." So I guess we did.
Oh, I just, remember back, God, I've been working in the group for several years now, but I think one time I used your words, there is no such thing as a botulism deficiency. And this lady went off on me, and
Yeah.
she actually private messaged me vehemently angry that I was cruel and mean. And I'm like, dude, I'm just I wasn't even rude about it. I was just like, girl, I'm just trying to help you here,
Yeah.
but it is such a hot topic. It's such a, we don't want you to walk away from this podcast going, oh, Leslie and Mary are judging me for my use of Botox. It's so far from the truth. We're just trying to warn people of the danger. and how
Right.
it's not going to actually help in the long run,
Right.
right?
Right. And I think intuitively everybody knows this.
Mhm.
Everybody knows they don't have a botulinum deficiency, right?
Right.
So, what I'm trying to bring to light for people is to connect into what they really already know.
Right.
And that is I'm having these migraines for a reason that can be figured out. And once I know, again, once people know what their blockers or deficiencies are within these three principles, and we work out a game plan that works for them to address that, the body is going to respond.
Mhm.
Right. And intuitively, this is what we're looking for. This intuitively is what I was looking for when I went into my medical doctor when I was getting migraines as a little whippersnapper 25-year-old and, irritating her because I kept coming back and wouldn't take the drugs because intuitively
Right.
I knew, right, that if I had somebody that could help me, I would
Right.
feel better. So this is my call to everybody listening. Tap into what you already know to be true.
Mhm.
And if like I say, if you think that I can help you, please reach out. Please reach out. If I can't help you, I will tell you that. If I can, I will tell you what that looks like. But this is my call to everybody listening. What do you already know to be true? You know
Mhm.
these drugs are not the answer.
Mhm.
And, unfortunately, people get upset when we tell them the truth sometimes,
Yeah.
right? And that's okay. I have gotten upset many, many times when people have told me the truth.
I think that just comes from the place of desperation and pain, and we get that.
Yeah,
Like, I didn't take it personally that lady was upset at me because I know that comes from desperation and
yeah,
pain.
yeah.
It did make me sad because I don't like being accused of purposely hurting people, but
Sure, sure.
yeah. But it was coming from a place in my heart of like just genuinely trying to help someone.
Absolutely, absolutely. And
Anyway.
sometimes, like I say, sometimes the truth angers people. That's okay.
Mhm.
That's okay.
But, yep, we will keep speaking it.
Exactly. Well, thank you, Mary. Thank you so much. Thanks for joining me today.
Yep, we'll see you guys soon.
Well, wonderful. And thanks everybody for listening. And before you go, be sure to like this episode and subscribe to this podcast. And please, if you have somebody in your life who's suffering from chronic migraines, please share this information with them. Who could benefit from this information that we talked about today? Please share that on your social media or share it with your friends and loved ones who've been praying for this information. And if you want to stay connected with Mary and I, please join our free Facebook group. We have nearly 12,000 women who are rediscovering a migraine-free life naturally. You can go to Healing Migraines Naturally with Leslie Caesar, ND, in the search box on Facebook, or you can go to healingmigrainesnaturally.com and we will redirect you there.